with that said, let's get started. So welcome to this Emma webinar on health management, managing the present and shaping the future. That was the title of our conference of Emma 2021 in September, held digitally in Lisbon. And this is the second part of a two-part series on really the key messages summarized from our most incredible rapporteurs you'll meet in a moment. We've got three key topics: person-centeredness and integration, improving healthcare access and outcomes, and sustainability. So I'm George Valiotis. I'm the Executive Director here at the European Health Management Association, and I'm just going to briefly set the scene before I hand over to our moderator. I'm going to just walk you through the conditions for the webinar. So the first thing to let you know is that we will be taking questions at any time during the webinar. Now, probably most of you are used to using Zoom. So at the bottom of your screen, you'll see the reactions where you can put your hand up digitally, and then we can come to you live to have your questions answered, which we'll probably do towards the end once the three speakers have spoken. But at any point in the chat, you can type your questions and you'll be able to have those questions answered as we go, or even at the end, we'll collect them. And also in that chat below, the team will be putting up any resources that I mentioned. So you'll be able to easily follow those links to find that information. We are recording the webinar, so if you wanted to see the PowerPoints or the recording at any time afterwards, it would be all available on emma.org. And then finally, we are tweeting during the event. You're welcome to join us there. If you don't already follow us, make sure you do that right now. It's @EmmaInfo is our hashtag, and we'll be tweeting using the hashtag Emma webinar. So that's it for the practical information. And what I'd like to do now is hand you over to our moderator, Dr. Axel Kani. He's the president of the European Health Management Association. Axel, thanks for joining us today.
Thank you very much for the introduction, George, and very warm welcome to everyone to this EMA webinar. I'm absolutely delighted to be here. This is round 2, as it were, and we have a packed program. So in today's webinar, we want to showcase the key learnings and discussions from EMA 2021. That's our annual conference, which took place last September on the theme of health management, managing the present and shaping the future. And the conference gathered over 450 stakeholders, healthcare stakeholders. It was a huge success for us, of course, as an organization, but also for everybody who participated, hopefully. And it discussed really challenges and solutions to the managed health systems during the current crisis, particularly now with the strains on the health systems all across the world. But it also really had discussions. We had loads of discussions to how to shape actually the health workforce and the health services for the future and how to lead them effectively. So the learning insights and the best practices discussed during the several sessions of the EMA, they were really highlighted in the conference report. And I know that somebody from the Secretariat probably will be so kind to place the link of the report in the chat at any time now. And the conference report is there for you to look at. It's great, a distillation of what has gone on in the conference, and it's really an invaluable resource for everybody to know more about what are the cutting edge issues, what is also the front line on the front line, as well as for health management in general. The conference report was put together by a group of rapporteurs, and some of them are with us here today, and we will hear from them very shortly. The conference report was developed as it were to give the most current overview of innovative developments and cutting-edge research in health management, and I really warmly invite you to download it, have a look at it, and see all the incredible, innovative papers that have been presented at the conference. Okay, this year we are pleased to have as our conference rapporteurs a very diverse group of researchers, experienced professionals, and as well as future leaders in healthcare management, really. And EMA is very grateful for their invaluable contribution and the time and effort they dedicated to this important activity to advance knowledge in healthcare management. I really can't overemphasize this enough. This has been enormous effort, and from the side of the rapporteurs, we're very very grateful to for their help. The Rapporteur program is an initiative EMA proposes every year. If you are interested in learning more about the Rapporteur program, you can get in touch with the EMA Secretariat. They would like to hear from you, of course, and they will share the contact email in the chat box probably just about now. And so do get in touch if you want to do something similar for next year. Is a unique opportunity really to kind of like be there and listen to it, and also to kind of summarize what has been going on. And that's a really unique kind of like experience for everyone. And it's a very, very important part of what the EMA conference is all about. So back to today's webinar, we will discuss 3 of our rapporteurs' reports and on 3 of the last year's conference themes. We'll start with improving healthcare access and outcomes, and continue with person-centeredness and care integration, one of my favorite topics, of course, and conclude with sustainability. So let me start by introducing you to the first speaker, Dr. João Futorge, who will share insights on improving healthcare access and outcomes. João is a medical doctor specialized in internal medicine. He works in a tertiary hospital where he's also a union delegate, and João did a postgraduate program in quality management in healthcare and is currently in a postgraduate program in healthcare management. His interests are optimization and simplification processes in the clinical setting and workforce provisions. And in addition to being a rapporteur, João has also presented one of the EMA PI sessions, in fact, on the impact of healthcare funding on patient outcomes. So that is something I remember very well, and it was really a fantastic contribution. And we're glad, very, very grateful to have him here. Thank you for being with us, João, and the floor is yours now.
Thank you very much. I will start my presentation. I will be talking about improving healthcare access and outcomes. And wait, this isn't changing. And whenever there was talk about improving healthcare access and outcomes, there were 2 main topics that came by. That was improving networking between stakeholders and the healthcare digitalization. To discuss access, since it's a complex theme, I divided in 4 principal topics. The first one is service availability. And in order to have better access service availability, during the opening ceremony, it was talked about the networking from top to bottom in order to make plans. So the plans can go by, we need to talk to each other. And also the healthcare digitalization with apps, everyone can access more easily outcomes, and we can also assess our outcomes and try to pull and benchmark our data and try to figure out our performance according to what is expected with those apps.
João, I'm so sorry to interrupt. I'm not sure if you can see your PowerPoint. I might be wrong, but I think you do have a PowerPoint, and I just wanted to flag that up. Okay. Maybe you can share that.
Are you seeing?
Laura, help me here, but I can't see it at the moment.
Sorry.
Okay.
Yes. Are you wait?
Yes, I think it's just coming up. Thank you so much, João. You can. Fantastic. Thank you.
And those apps can also check our outcomes, and I can compare my outcomes with is expected, increasing my productivity, increasing my outcomes and my performance. With personal barriers, there also talked about Rebecca during the PI session, where we can gather data from social media, and people will give us outcomes and will give us their performance, for example, in this case with chemotherapy, on real time, and I can check them and have results easier. And during the COVID and during the presentation, it was also highlighted that the COVID-19 pandemic showed us that we can have alternative ways to educate patients about their diseases. And during one of the presentations, which that was the RSV presentation, also talked a lot about the needs to educate our patients and increase patient literacies that can alleviates the pressure in primary care and consequently in hospital care. Financial barriers are also important because we need funds and we need support to implement our projects. And during the Novartis presentation about cardiovascular diseases, they came with a solution of public-private partnerships in which they both fund the projects so they can increase the accessibility of new drugs and new mechanisms of diagnosis. In terms of organizational barriers, I need to talk about this, that is the necessity to everyone from top management to healthcare professionals, healthcare providers, to talk about every issue that's important, because nowadays we are facing a shortage of doctors in my country, and there are ERs closing, and if we don't talk with each other, we cannot solve the problems, and we can make these problems increase and can make these problems go way beyond what was expected. And yet again, they talked about multidisciplinary teams to improve effectiveness and improve the quality of the decision, because we need to know which one is expecting what, which one is talking by. And another thing that will change, it's the current migration, and the demographics might change. And with that, we might think, or might have to think, what we want as a society in order to provide for these people. And it's we might have to change our organization as an healthcare system. And in respect of outcomes, during the PI session, it was highlighted that we are having shortages of resources so we might need to optimize every cost and every benefit of our programs, and measuring value. It might be needed way beyond the clinical setting, and also go into the political setting to measure value and compare outcomes and funding with every state member. And there's also important that nowadays people are talking more and more and more outcomes, and even doing the media, and this will go past for the public. There is another thing that was highlighted, that was to put the patient in our decision-making settings. So the networking shouldn't be only about top management, middle management, and healthcare practitioners, but also with the patient, because they have their unique way of view and they have their unique perspective on their problems, and ultimately they will be the ones giving us the prompts. So they should be seen as clinical, but also not only as a clinical setting, but also a political setting and decision setting. And this will go beyond that, because maybe we need to start thinking about us not as a country, but as a Europe, and broaden our network settings between every state member, so we can compare outcomes and try to decide what's better, which is the better funding, which will be the better, which will give us the better results. And so this shouldn't be seen as take-home messages, but also as keep-home messages, because we will need to improve our networking between all the stakeholders, from patients to political setting, but with that we might need to improve our healthcare digitalization, and with better healthcare digitalization with 5G we might have faster networks and we might improve our networking within stakeholders. So I think these were the two main messages that I think that we should keep with us from this session, from this conference. So that's it.
Thank you so much, Ao. That's a tour de force through a very, very complex field, of course. And thank you so much for how well you distilled that into a keep at home message, not a take home message, but keep at home message. I think we get that message very well, with many of us working from home as well. So it's fantastic and fascinating aspects in that. And of course, we'll come back to that, discussing that, Joe, later on when we come to the question answer. I think there were plenty of things to do there and plenty of things to discuss for our audience as well. And of course, just a reminder, you can ask a question in the chat, and we will pick up those questions in the question answer section later on in the session. Thank you so much, Joao. That's fantastic. I'm moving on to introduce our next speaker. And let me just to say, we are very, very pleased to have Mr. Terry Ailena-Aurien here, who will tell us more about person-centeredness and care integration. And Terry is a registered nurse and a PhD candidate in the Welfare, Health and Management doctorate program at one of my favorite universities in the world. That's the University of Eastern Finland in Kuopio. She has done her doctoral studies, and she is focusing in her doctoral studies on studying aging and the needs for and use of health and social services from the perspective of subjective well-being, using European share survey data and data from national registers in Finland. So that's a fascinating doctoral study, of course, but today we hear her distillation of some of the main messages on person-centeredness and care integration. Thank you for being with us, Terry. Looking forward to your presentation.
Thank you. I will share my presentation. Except that it doesn't seem to appear here where I can select the things to share. It worked like 10 minutes ago.
I can share it for you, Terry, if you want.
Yes, please. Yeah. I think it's easier.
Great.
Okay, so my name is Terhi Auvinen, and I'm study health management sciences, and I also work as an early stage researcher. In this presentation, I summarize how person-centeredness and care integration were discussed on or addressed in the EMA 2021 conference. I will go through both topics by answering 3 questions: how person-centeredness or care integration was described in EMA conference, why is it important, and how to achieve it. According to EMA, person-centered care recognizes individual needs, preferences, and values, and is therefore essential, especially for patients with multiple and complex health needs. Person-centered care involves the patients in their decision-making and care planning to ensure that their needs are met. And it is argued that as population ages, healthcare delivery becomes more complex and less patient-centered as more organizations and professions become involved due to specialization of healthcare. Next, please. So why is it important? According to EMA, patient-centered care with personalized medicine can improve disease outcomes and, most importantly, enhance patients' quality of life. And by focusing on quality of life, it is possible to increase the quality of care. And for that, the person-centered approach can be cost-effective. There was also relevant discussion about COVID-19. Personalized care is important also from that point of view due to wide inter-individual variability in response to virus exposure. Therefore, international collaboration is important. Next, please. And how to shift towards more person-centered care. According to EMA, we should develop participatory processes and facilitate joint decision-making between patients and doctors. Patients should be seen as partners. We should measure outcomes that matter to patients. Patient journey mapping, for example, may help to shift from organizational logic to patient's perspective. This could actually be useful exercise for all kinds of organizations and in all levels of the organization. Also, digital health was seen as a tool to improve person-centeredness by improving access and maybe also by providing a platform where patient and the professionals can interact. The COVID-19 pandemic was seen as an opportunity for digital health, eventually changing the provision of healthcare permanently. Next, please. Then we have the care integration. In EMA 2021, integrated care was described as a transactional movement to ensure continuity of healthcare. World Health Organization points it to be people, not patient or person-centered. It was said that there is no single model of integration, but more often consensus around the principles. In one session, there was discussion about 5 suggested levels of integrated care, fragmented being the most common one at present time. The COVID-19 pandemic was found to underline pre-existing vulnerabilities of healthcare systems, including care fragmentation. Next, please. So why should we move towards more integrated care? According to EMA, there's evidence, yet inconclusive, that integrated care improves patients and family satisfaction, and it improves population health and reduces health inequalities, and improves efficiency of healthcare system. Also, the integrated system enables us to evaluate where the resources need to be. It also supports continuity of care, especially among patients with multiple needs. Next, please. And lastly, how can we achieve this? Care integration requires integrated digital information systems and also integrated health registers and data. And as digital health becomes more and more essential, we need to avoid digitalization in silos. Health organizations should focus on patient participation in decision-making. This includes involvement of patients' organizations and other NGOs. Involving patients' organizations is also important in order to support better health literacy among patients. And finally, here are some leadership challenges pointed out. Personally, I would like to underline this last bullet point: partnership across different sectors, including patients' organizations and other NGOs. This really requires leadership skills, but it's definitely worth it. Thank you. This is it.
Thank you so much, Terry. Thank you. That's great. That's fantastic. And thank you so much for this very, very informative presentation. And it's fascinating to see how the person-centeredness really has actually just making inroads into integrated care delivery, and it's still a struggle. It's still a very, very uphill struggle. And can I also say that EMA just published a paper on integrated care and the digital health system, the health data space that is being developed in Europe at the moment. And I put it in the chat there so you can see it. It's a paper by Egida, a particular group on integrated care. and EMA is very proud to host that paper on its website. So thank you so much, Carrie, for this very, very informative and very, very well delivered presentation. And we are on time as well, so that's great. That's always a pleasure to me. And last but not least, I'm giving the floor to our third rapporteur, Mrs. Kasia Skocek, who will be presenting the insights on health system sustainability. Kasia is a student in international health science at the University of Applied Science Fulda in Germany. And in her specialization, she focuses on health management to better understand the interrelationships and processes of the healthcare system and the basics for managing healthcare institutions. Kasia is also currently doing an internship at the EMA Secretariat. So very, very happy to have you there and very grateful. Thank you for being with us, Kasia, and the floor is yours.
Well, thank you for the introduction. I will share my screen. Now you should see it. Is it full screen?
We can see it, but not in the PowerPoint, not in the show mode yet. In the presentation.
Now it should be.
Now it is now. Thank you, Kasia.
Perfect. So good afternoon. Like Axel already mentioned, I'm Kasia Skocek, one of this year's conference rapporteurs, and I'm going to talk about the EMA 2021 insights and highlights on the topic of sustainability. Sustainability has become more and more relevant over the years, so it's only natural that an entire session is dedicated to sustainability in the healthcare sector and looked at from various perspectives. It showed how strong interactions between healthcare and the environment certainly affects the system's ability to generate health for the population. Since the health sector is responsible for 4.4% of global net emissions, the future of health workforce will require a new set of skills to prepare them to analyze complex environments and propose new strategic solutions to current and future problems. In future programs to train healthcare professional skills will cover three main areas: analysis, integration strategies, and advocacy. The main objective for future managers will be mitigation, identifying actions to reduce carbon footprint of the healthcare sector, and resilience, which means that future leaders have to prepare for the impact of extreme weather and the shifting of burden of disease. The emissions and climate change aspects are usually the first thought when we think about the impact of climate change on the health sector. However, it is important to consider not just the carbon footprint of healthcare facilities and industries, but all the related activities around the system. One aspect of environmental sustainability is the management of pharmaceutical waste. Research showed that many households kept unused medications at home and were convinced that it is correct for the drugs to be returned to the pharmacies who will take care of their disposal, which underlines that improper drug disposal is still prevalent. Medication waste has a high impact on healthcare budget and harmful effects on the environment. Therefore, preventing medication from remaining unused through the pharmaceutical chain is a relevant approach to achieve sustainable supply and use of medication. It's a need to analyze the life cycle of medications in order to implement preventive actions, such as delivering correct and complete information to the patients when prescribing or selling the medications, organize effective and easily accessible programs, and educate and raise awareness to reduce pharmaceutical waste. During the presenter's abstracts, it was highlighted that many healthcare facilities are incredibly old and thus outdated. Hence, an evaluation of these healthcare facilities is needed to make strategic interventions and promote good and sustainable healthcare. Tools like the presented SAS Health V2 can evaluate healthcare facilities to support the decision-making processes to improve the quality of the buildings. The tool has been developed by involving experts from various sectors who identified 3 levels that must be evaluated: a social, environmental, and an organizational level. Improving the quality of these buildings is crucial and yields numerous benefits, such as the reduction of negative outcomes, greater efficiency, effectiveness, and savings in the final cost of maintenance and organization, which results in a more sustainable health service delivery. And finally, social sustainability is also emphasized. This year's conference addressed the question of how gender medicine influences healthcare. Gender medicine is increasingly oriented towards a widening of the focus from the protection of women's health and a greater weighting of biological, social, cultural, economic, and environmental variables in determining the health status of people, so as to integrate the perspectives of equity and respect for human rights by promoting more effective and efficient health systems. Hence, focusing more on gender medicine would help improve health, better allocated economic resources, and thus optimize cost effectiveness, which results in achieving economic and financial sustainability without compromising the quality of the treatment provided. And throughout the conference, it becomes clear how diverse sustainability can be. However, what stands out most is that no matter on which aspect you are focusing, we as health professionals can only overcome the challenges of the climate crisis and sustainability obstacles together in collaboration. Policymakers and healthcare managers should grow together in developing climate change mitigation and adaptation actions, since climate change has also been seen as a challenge for the whole healthcare sector. We should focus on energy efficiency, low carbon transport, and medical waste management. And again, we can only achieve this change in a sustainable health system through the commitment and contribution of every health professional. And with that, I thank you for your attention, and back to you, Axel.
Thank you so much, Kasia. That's really fascinating. And how important that topic of sustainability is really reflected in the fact that about 10% of our GDP in OECD countries is really spent on health services. So it's an enormous amount. That is just on average. In some countries it's higher. So thank you so much, Kasia. That is something and plenty there to discuss. Really for everyone. And can I just remind everybody that the conference reports, the individual conference reports that were presented at the conference will actually be published in the Portuguese Journal of Public Health early next year. So if you wanted to check out the abstracts of the conference that were delivered at the conference, go to the Portuguese Journal of Public Health early next year. Somebody, I'm sure, will actually be able to post the link in the chat room there, and you can basically then go to the Portuguese Journal of Public Health, and that's where you will find the conference abstracts, and it will be published early next year. So you still have to wait a bit, but maybe just bookmark that page. It will be important to if you wanted to check out all the abstracts. Thank you so much. Thank you to Kasia, Terry, and Joa for their amazing presentations. And we just heard a lot of summary of the evidence presented at EMA 2021, but I would now like to open the floor for questions. So if there is anything you wanted to ask, I'm sure there is plenty to discuss, so the floor is open. You can either ask questions in the chat room or you can, or in the chat on the site. And I know, well, Sandra Buttigieg has actually joined us, and her hand is up. So yes, I'm going to start with Sandra. Welcome, Sandra.
First of all, I apologize that I had to come in late, but I've been following the conference rapporteurs also through through the EMA website, through George. He's been giving us a lot of information, so thank you all of you for this. I think this is a very good idea. Coming to the subject in question, I'm very interested about the question of sustainability. And also today you've discussed the person-centeredness as well. And I think I believe that one way to look at sustainability is to give more power, so to speak, but also responsibility to the individual patient as a person, because in that way we will also have better compliance, we will be actually managing patients as persons, as members of society, as members in their own family, and also in accordance with their wishes. We should be giving a voice to patients, because in that way, that is one of the answers for sustainability. My second point is with regard to the extent to which the discourse is shifting from not just sustainability, but sustainability and resilience. And I believe the pandemic is testing each and every one of us about resilience, because it's one thing saying that we can keep on going. I've just come out from quarantine, for example, and it's not a nice experience at all. So imagine healthcare professionals, even the public, in order to withstand the challenges that the pandemic is throwing at us. I think it has been really something that it's taxing, it's tiring, and I think resilience is very important. My third point is also, in order to achieve these perspectives, I believe that as EMA, we need to keep on insisting on the importance of leadership. And we've been hearing so much now about the importance, not just of the leadership styles that we were actually very familiar with in terms of transformational leadership, servant leadership, authentic leadership, but now also I believe, and this is something that's coming out loud and clear, in particular from the King's Fund in the UK, compassionate leadership. And of course, in order to withstand all these challenges, we need also a leader to be agile. So leadership agility, I believe, is also something that we should be doing more research on. But compassionate leadership, I believe we need to put more of a human face to our leaders, to be more compassionate with what is happening around us, and try and move ahead with all these complications that we have. I want to be positive, because it's not good to be negative. But yes, I think if we manage, if the pandemic helps us to change some of the things that perhaps we used to take for granted in the past, and maybe learn from them, my worry is that we, as a human race, we quickly go back to our old habits. And maybe that is not something that is fruitful, at least thinking positively about the pandemic. Thank you, Axel, for your leadership. And thank you, George, for leading all this. Thank you.
Thank you so much, Sandra. I agree. I want to put the question about resilience, because Sandra raised a really important question about the resilience there. Maybe can I bring Zhao back into this? Zhao, you're a medical doctor as well. Resilience on the front line during the pandemic. Maybe there's maybe you could give us some of your reflections on that issue.
Yes, I was actually a frontline doctor, so that's a big aspect. And resilience in the past week was quite a discussion topic, because our healthcare minister actually made some remarks about that. But the thing is, nowadays we have to watch out with what we are doing with healthcare, because we have market values and social values in medicine, and the social values are the main thing that keep us doing that extra percentage of work with apparently non-monetary compensation. But if we try to apply only market values to our profession, we might lose our resilience, and that's a thing that is worrisome. Because nowadays, my colleagues in the post-COVID phase, we are refusing to do that extra work, because we are in burnout. Tons of my colleagues are in burnout, especially in internal medicine, primary care, which pneumology, that were the specialties that were in the front line. So with resilience, we might have to think about and try to rethink our role as healthcare providers. And that's why we need networking. We need to work with each other, not against each one. And I think because management needs to understand also that that resource isn't a bottomless pit. So I think the future to overcome resilience is to find ways that we might compensate that resilience. I'm talking with colleagues for a study about that and try to guess what are making us go beyond a private to public, so from public to private sector. That's also an issue. And nowadays people are saying that they have no time for anything. We cannot check up a patient conveniently, and we have that ethic dilemma that we'll go home and we might not have done everything that we can. So with that, and in this special phase that we diverted, because to be honest, we have two separate healthcare systems, one for COVID and one for non-COVID, and with almost the same resources. So that's resilience, because we adapted and we overcame financial constraints, workforce constraints, and tons of stuff. But we have to rethink what we are doing and which resources we are spending. So because this won't last forever.
Yeah, that's great. Thank you so much, Al, for this. And just a brief reflection on England, because Sandra mentioned also self-isolation and during COVID times, etc. For the nurses here in England, the government has now actually put their money where their mouth is, and they put on a multi-million-pound program where nurses come out of self-isolation. They will get actually extra supervision and support. They call it restorative supervision. But from a dedicated mentor, simply because the chances of burnout are so great, unfortunately, at that point when somebody comes back into work. So really fascinating discussion here. There is a question from Flora Coelho in the chat. I just wanted to ask that. That goes to Terry. How does Corona pandemic affect the person-centered approach skills amongst healthcare professionals? So how does it affect the skills amongst as healthcare professionals? How do we solve the compassion burnout? And of course, that links with Sandra's and Joa's discussion just now. What are the best possible management strategies? Terry, do you want to take that up, please?
Well, yes, this is an important question. Thank you for this. And like Sandra brought up, I think compassionate leadership is important here. And I think I speak for the nurses. Nursing professionals need to be seen and heard in this situation, and leadership should support this. And the workload should be made bearable to them. We just simply need enough staff to get through this. And you were asking about this compassion burnout. I think one other relevant question is, what if this compassion ends? There's people who are not vaccinated. How do we support the nurses to treat them? It's they are professionals. They know how to treat them, and they do treat them with respect. But still, there's something to think about.
Absolutely, and there are major challenges and questions coming towards us, aren't they, about vaccination rates amongst nurses and healthcare professionals, and how do we deal with our colleagues who want to put in the work, but there might be barriers to uptake of vaccinations, etc. So maybe that links also to the leadership issue that Sandra brought up earlier. So that's really important. Absolutely. Can I just come back also to just briefly to Kasia? Kasia, the issue around sustainability isn't just one about material resources, of course, and environmental impact. The issue about sustainability is also about workload and for the human resource, as it were, isn't it? I mean, our professionals. Is there anything that you seem to have picked up during the conference around the human resource and sustaining the human resource of professionals, maybe?
What I gathered from the conference is that at the moment we simply haven't enough people to to carry our health system. And I can say it for like Germany, that now all the nurses, doctors, and who else works in a hospital is just burning out. And we need to address like the staffing issues by campaigns or different marketing strategies to get more people into the healthcare system, so we can all together try to carry our health system again.
Yeah, absolutely. That's really interesting, and we need new innovative ideas to do that. I mean, there is a limited resource of staff. We noticed during the pandemic, there's no point opening new hospital beds somewhere if we don't have the staff to actually be there at the hospital site, the hospital bedside. So that's a really limited resource. I do want to come to maybe possibly one of the things I heard earlier on as a solution. Joao, I'm not so sure whether you sort of like can reflect a bit more on the proximity programs. You mentioned proximity programs in your presentation. Was there anything you can tell us a bit more about these proximity programs by any chance? Because I think that sounds like a novel, innovative kind of idea about how to ensure that the limited resource of staff is actually used. John, would you like to elaborate a bit on this, maybe?
Yes, and one of the main things that's happening nowadays in my country is that the primary care was all diverted to the vaccination programs and to the COVID-19 response. And we have a large influx of in the tertiary care hospitals, which is of people that simply lacked vigilance. So I think that with improved healthcare technology and digital access to the population, we might reach to easier to the population. And if you can implement that and vigilance throughout other means, that people don't actually need to go and present themselves to our and present them to the doctor, like the Rebecca program, they can actually monitor people. That also comes by with tons of ethical issues, that they're being monitored not actively but passively. So, but I think that's a great solution. Or, for example, integration of the blood pressure monitors, for example, in their in some sort of page that can monitor also their vitals and make screenings. So if you can manage to digitalize healthcare and digitalize data, we can reach passively more people, and passive programs might help to attenuate the shortage of doctors and appointments.
That's fantastic. Yeah, that's really, really helpful. Thank you so much, Joao. That's great. And as we're coming to the end of this session, I just wanted to say there's also a comment from Floro still in the chat. But do check it out. And he mentioned the Nurses Climate Challenge and the Green Doctors Program. So that's something maybe you just want to check out, Google it and see what these programs are about. And that is something that, of course, relates to the sustainability issue that Kasia told us about today. Okay, I think this is coming to an end to the session. Thank you so much. We have still a couple of announcements, but before I come to the end, I just want to say a big thank you to all of our rapporteurs, and I also wanted to give a special thanks to the person who has actually coordinated the rapporteur program and put together the final report of this, and that is Evelyn Donoghue. Evelyn actually has been working at EMA to make this all happen. So a big thanks to her, and a special thanks to the Secretariat, of course, as well. So thank you very much to all of the speakers here today. We are now at the end. I want to thank once again the 22 rapporteurs for their commitment to the EMA conference. It's a huge time commitment. It's a huge effort on their side, and we're very grateful for that. And this is a second webinar to discuss the key learnings from the 2021 conference. The recordings of both the webinars will be available on the EMA's website. And I think we have a bit more further webinars, and EMA has many other upcoming events. And I think we hear some exciting news from George, hopefully, about the conference maybe next year. So I hand over to you, George.
Absolutely. Thanks, Axel. Thanks so much for your great moderation. And I just echo your thanks to the rapporteurs. You've done incredible work for the cause of health management, and really not just the people who presented today, but all of you asking questions. This is exactly what EMA exists for. We want to bring together anybody interested in the whole ecosystem of health management to have exactly discussions like this, whether they be in these webinars, at our annual conference, or at our executive training, or our special interest groups. If you're interested in more things like this, make sure that you follow us on Twitter, make sure that you come to our conference. I've got a slide up about it just now. And this year, this coming year, so in June 2022, we'll be meeting in Brussels, hopefully face-to-face. And it'll be a great chance for you to present your work. If you have an abstract you'd like to present, then we're currently accepting abstracts until the middle of February. So check out the emaconference.org. The link to the site's been put up in the chat. And we'd love to see you in Brussels for more discussions like this. So again, if you want to present an abstract, if you would like to be a rapporteur, we would love to hear from you so you can be part of this important movement. So apart from the conference, we also have an executive training series that if you've got any interest in, we'd love to see you at. The series is a group of 4 workshops, so you can attend one of them, but what we're really encouraging is if you're from an organization, you can get a ticket for all 4 of the webinars and of the training sessions, and any one of your colleagues can attend, so you can share it across your colleagues. That one is a fee for attending, so check it out on our website, and it's a great investment if you want to really refine your practice in the themes described there. And then just finally, I'd like to say a big thanks to everybody, because you've all been part of helping us grow to our 40th anniversary for next year, which means our conference in Brussels, our executive trainings, everything's going to have some extra effort and extra color, and we'd love you to be really a part of our 40th birthday next year, which we will celebrate throughout the whole year. So do stay tuned for lots more exciting events like you see there. So thank you very much, everyone, for attending. We are going to leave this room open now, like Axel mentioned, for a couple more minutes. You can stay for as long or as short as you want. Of course, we try to keep these condensed for your busy schedules. But if you did have more things you wanted to talk about, some of the speakers might stay if they're able to, but it's up to you. The doors will stay open for as long as we can seize necessary, and you're welcome to stay and have a chat with us. Thanks very much for joining.
Thank you.
Great, so that's the recording of the webinar officially over. Emmy, if you could stop the recording and take the slides down. And